My name's Dr. William, and I need you to do something right now before you watch another second of this. Look at your hands, not a glance. Really look. 10 small surfaces at the tips of your fingers. Most people see something to clean, something to paint, maybe a rough edge to file down before the weekend. I see something entirely different. In my 15 years of practice, I have watched lung cancer, liver failure, and severe anemia announce themselves on fingernails months before the patient felt a single symptom. Not weeks, months. Here is what almost no one explains to you in a 1-2 minute office visit. Your nails are not cosmetic. They are a living record of everything your body has been through for the past 6 months. Every ridge, every color shift, every change in shape is an entry in that record. The only question is whether you know how to read it. Drop your age in the comments right now. I want to know who is watching, because what I'm about to tell you depends on how long your body has been keeping that record. And before we go any further, I need to demolish one myth that has been circulating since before you were born. White spots on your nails mean you are low on calcium. You have heard this. Someone told you as a child, pointing at a little dot on your pinky, it is completely, clinically, demonstrably false. Research published in the British Journal of Dermatology, one of the most authoritative peer-reviewed journals in its field, has definitively disproven any connection between those white spots and calcium deficiency. If you have been believing the calcium myth, you have almost certainly been misreading every other signal your nails send. And some of those signals are a matter of life and death. Let me start with a story. Let me tell you about someone I will call Margaret, 7'1", from Phoenix. She came into the office for a routine blood pressure check. While she was there, I asked her to hold out her hands. Both thumbnails were domed, convex, curving over the fingertip like the glass face of an old wristwatch. The fingertips themselves were thickened. She had noticed it for about a year and assumed it was just age. It was not age. That finding, which clinicians call clubbing or Hippocratic fingers, named because Hippocrates described it 25 centuries ago, is associated with lung cancer in roughly 35% of cases, also with pulmonary fibrosis, congenital heart defects, cirrhosis, and inflammatory bowel disease. Every item on that list is serious. We ordered imaging, early stage lung cancer caught before she had a single respiratory symptom. The nails caught it first. That is not a comforting story designed to make you feel good. That is a clinical fact, and it raises a question you should be sitting with right now. When was the last time you actually looked to understand why a nail is such a powerful diagnostic tool? You need to understand what it actually is. The hard surface you see, called the nail plate, forms inside a tiny zone of living tissue tucked under the skin at the base of your finger, just beneath the cuticle. That zone is called the matrix. Think of it as a small printing press that runs continuously, 24 hours a day, pressing out new nail tissue. The press is extraordinarily sensitive. Any disruption in your metabolism, any nutritional gap, any inflammatory process running anywhere in your body, and the press records it in what it produces, the plate changes color, shape, texture, and growth rate. A full nail replacement takes 4 to 6 months on average. That means right now on your hands, you are carrying a 6-month archive of your body's internal history. 90% of the nail plate is made of a structural protein called keratin, the same protein that makes up your hair. But the architecture is completely different. In a nail, keratin fibers are stacked in layers like sheets of plywood, bonded together by sulfur bridges. Those bridges are what make the nail hard. Hair lacks them, which is why hair bends and nails do not. This also means sulfur matters for nail strength. When the diet is low in sulfur-containing foods, eggs, garlic, cabbage, the layers begin to separate. Splitting and peeling appear at the surface. But underneath, the mechanism can be pointing to something more serious than a dietary gap. Between those keratin layers sit microscopic films of fat and water. They give a healthy nail its faint gloss and smooth feel. When the body is chronically dehydrated, and as we age, the brain's thirst center becomes less reliable, meaning people routinely drink less than they need without knowing it, those films thin out. The surface turns dull, develops small cracks, loses flexibility. Most people blame winter or too much hand washing. The real cause is often sitting in a glass they are not filling often enough. Beneath the nail plate lies the nail bed, a thin layer of tissue threaded with capillaries. Blood shows through it, giving a healthy nail its pinkish tone. The oxygen level in that blood, the concentration of hemoglobin, all of it is visible right there on your fingertip. Hemoglobin drops and the pink fades toward white. Oxygen falls and a blue gray tone creeps in. Bilirubin rises and yellow appears. Bilirubin is the breakdown product of red blood cells, and when it accumulates, it means the liver is struggling to clear it. 10 small screens at the ends of your fingers, broadcasting your body's internal state in real time. Now, I want to take a moment because we have already covered a great deal of ground and there is much more ahead, and I want to make sure none of it gets lost. We have talked about the calcium myth that has been misleading people for generations. We have talked about the matrix as a 6-month recording device. We have talked about the first warning sign in Margaret's case, the domed, club shaped nail that pointed to a lung problem before any other symptom existed. And we have gone through the basic anatomy, why color, texture, and shape all carry diagnostic weight. All of that, the exact mechanisms, what to look for, and how to act on it, is developed in full detail in the complete Senior Health Vault. It is the plain English guide I put together with everything I wish I had time to explain in the office, covering the medications worth questioning, the foods that work like medicine, and what your body is telling you after 70. You will find the link in the description, and you can scan the code on your screen right now. And stay with me because the most important signal in this entire video is still coming, and it involves a finding most people walk right past without a second look. Now, let us go through the specific color signals because each one maps to a different system in your body. Yellow nails are the most common complaint I hear from patients over 60. The first cause is fungal infection. Organisms get under the free edge, break down the keratin, and the plate changes color, thickens, and becomes crumbly. Most people shrug it off. It looks bad, but does not hurt. That is a mistake. Fungal infection is an open door for bacteria. And if you have elevated blood sugar, what seems like a minor nail problem can cascade into something life threatening. Every year in the United States, hundreds of thousands of lower limb amputations are performed, and a significant number begin with a fungal nail infection that someone decided was not worth treating. That is not an exaggeration. That is a documented clinical pattern. The second cause of yellow nails is more systemic. There is a condition where all 20 nails, fingers, and toes turn yellow at the same time, thicken dramatically, and grow extremely slowly. At the same time, the patient develops swelling in the lower legs and chronic respiratory problems. 3 symptoms, 1 underlying cause, a failure of the lymphatic system. The lymphatic system is the body's network of vessels that removes excess fluid and metabolic waste from the tissues. When it breaks down, everything suffers together. In this condition, called yellow nail syndrome, the yellow nails are not a cosmetic flaw. They are a manifestation of a system-wide failure. Blue, gray, or violet nails. Remember those capillaries beneath the plate? When blood oxygen saturation drops, hemoglobin darkens, and that darkness shows through the nail. Blue nails are a classic sign of tissue oxygen starvation. The causes include chronic obstructive pulmonary disease, which is a condition where the airways narrow and air cannot move properly, severe asthma, congenital heart defects, and severe anemia. One additional cause worth knowing: certain medications used to control heart rhythm, called antiarrhythmics, can produce the same blue discoloration. If you are taking one of those medications and you notice a bluish color developing in your nails, do not wait for your next scheduled appointment. Tell your doctor as soon as possible and never stop a medication on your own. Bring it to your doctor and describe what you are seeing. Green nails are less common. The usual cause is a bacterium called Pseudomonas aeruginosa, which thrives in moist environments. Cooks, dishwashers, anyone whose hands spend significant time in water is in the risk group. The green color is a byproduct the bacterium produces. Without treatment, the infection progresses deeper into the tissue. Now, pay close attention. This is the most important color finding in this entire video. A dark longitudinal stripe, a narrow brown or black line running from the base of the nail to the tip can appear on a single finger. In most cases, particularly in people with darker skin tones, this is completely normal, the result of pigment producing cells in the matrix becoming active. But there is an aggressive form of skin cancer that develops specifically beneath the nail plate. It is called acral lentiginous melanoma. It is dangerous precisely because it masquerades as a harmless streak for a long time. The warning signs that should send you to a dermatologist today, not this week, not at your next available appointment, today. The stripe is wider than 3 millimeters. The edges are blurred rather than sharp. The color is uneven within the stripe, or the pigment has spread beyond the nail onto the surrounding skin of the finger. Any one of those features demands immediate evaluation. Early detection is the difference between a curable finding and a life-threatening one. And the code is still there on your screen if you want to keep that list close. Now let us talk about shape, because some changes in shape are specific enough that an experienced clinician begins forming a diagnosis the moment they glance at your hands. Hold your hand flat on a surface and look at your fingers from the side. A healthy nail has a gentle outward curve, a shallow arch. If instead you see a concavity, a dip in the center like a tiny spoon, that is called koilonychia or spoon nail. It almost always signals a significant iron deficiency. Iron is directly involved in building the keratin structure. When iron falls short, the fibers do not stack properly, and instead of an arch, the nail develops a hollow. Here is what is remarkable about that. Spoon nails can appear before iron deficiency shows up in a standard blood test. The body protects hemoglobin levels for as long as possible by redistributing its iron reserves, but the peripheral tissues starve first. Your fingers are ahead of the laboratory. Koilonychia also develops after years of exposure to harsh chemicals without hand protection, bleach-based cleaners, solvents, acids. These agents break down the sulfur bridges holding the keratin layers together. The nail loses rigidity and buckles inward. After 5 to 7 years of unprotected exposure, the structural damage becomes irreversible. Gloves are not a recommendation here. They are a requirement. The opposite finding is a nail that is excessively convex, domed, rounded like the glass face of a watch, attached to a fingertip that is itself thickened and club-shaped. That is the same clubbing I described in Margaret's case. In certain pulmonary and cardiac diseases, substances released into the bloodstream stimulate the growth of soft tissue around the last joints of the fingers. The fingertips thicken, the capillaries expand, and the nail arcs dramatically. Lung cancer accounts for roughly 35% of cases. The rest include pulmonary fibrosis, which is scarring of the lung tissue, pus in the chest cavity, congenital heart defects, cirrhosis, and inflammatory bowel disease. There is a quick test you can run right now. Press the nails of matching fingers together from both hands, nail to nail. If you see a small diamond-shaped gap between the bases of the two nails, that is normal. If the nails press flush with no gap at all, that finding warrants a conversation with your doctor. It is called the Shamroth sign. 3 seconds, no equipment needed, and remarkable clinical accuracy. Now, look at the surface of each nail under good light. Most people over 60 will see thin lines running lengthwise from base to tip. In most cases, that is simply aging. The matrix begins working less evenly over time, like a printer that has developed a slight feed irregularity. By 70, virtually everyone has some degree of this, and it is physiological. But if those ridges appeared suddenly over a period of months rather than years, or if one or two are dramatically deeper than the rest, that is not normal aging. That points to a B vitamin deficiency, impaired absorption in the small intestine, or the early stages of rheumatoid arthritis attacking the small joints. Horizontal grooves, deep furrows running across the nail from edge to edge, are something entirely different. These are called Bowes lines, and every one of them marks a moment when the matrix temporarily shut down. A high fever, major surgery, chemotherapy, extreme psychological stress. The body diverted all resources to survival, and nail growth paused. When the crisis passed, growth resumed, but the groove remained permanently in the plate. And here is the part that surprises most people. You can calculate when the event occurred. The nail grows at roughly 3 to 4 millimeters per month. Measure the distance from the groove to the cuticle, divide by 3, and you have the approximate number of months ago it happened. Retrospective diagnosis from a physical measurement, one groove means one isolated episode. Multiple parallel grooves mean recurring crises. Grooves across all 20 nails simultaneously mean the whole body took a systemic hit. Many people who went through a severe illness experienced characteristic transverse grooves 2 to 3 months afterward. The body recorded the battle exactly the way a seismograph records an earthquake. Look also for tiny pits on the nail surface, small indentations as if someone pressed a pin into the plate repeatedly. They do not hurt. Most people walk past them entirely, but multiple pitting across several nails is one of the earliest signs of psoriasis, an inflammatory condition where the immune system attacks the skin's own cells. The pits can appear years before the first skin plaques show up anywhere else on the body. Your fingers are warning you about a disease that has not yet surfaced anywhere else. The same pitting pattern also occurs in alopecia areata, where the immune system attacks hair follicles. Scattered pitting plus surface roughness can point to two autoimmune processes sharing one underlying mechanism. Now, three words that patients use interchangeably, but that describe three distinct clinical pictures: brittle, peeling, crumbling. Brittle nails are dry, stiff, and crack under pressure. The primary cause is a sluggish thyroid gland. The thyroid regulates the pace of metabolism in every cell in the body, including the nail matrix. When thyroid hormones drop, keratin production slows, and the plate becomes rigid and fragile like dried clay. The second cause is chronic dehydration. The brain's thirst center becomes less sensitive with age, and people regularly drink less than they need without feeling thirsty. Nails are among the first tissues to lose moisture when the body is running dry. Simply increasing daily water intake to around 50 to 60 ounces can produce a visible improvement within 2 to 3 months. Inexpensive, simple, and well documented. The third cause is external aggression. Acetone based nail polish remover, alkaline cleaning products, and alcohol based hand sanitizers used 5 or 6 times per day over several years are a reliable path to brittle nails. Peeling nails split at the free edge into thin horizontal layers, like sheets of mica. This often traces back to the digestive system. Impaired absorption of fat soluble vitamins A, D, E, and K depletes the lipid layer that bonds the keratin sheets together. This happens most commonly when the pancreas is not producing enough enzymes to break down dietary fat. The person eats a normal diet and still does not absorb what they need. Strict, low fat diets pursued for the sake of cholesterol management can produce the same result. Dietary fats are not just a cardiovascular concern. They are required by your skin, your joints, your brain, and your nails. Peeling plates are often the first surface sign that fat absorption is impaired. Crumbling nails disintegrate. The plate becomes porous and chalky. Most often, this is advanced fungal infection penetrating deep into the plate and turning hard keratin into a spongy mass. But the more dangerous version is dystrophy caused by peripheral vascular disease, narrowed blood vessels from long term smoking, diabetic arteriopathy, or atherosclerosis starve the matrix of oxygen and nutrients, and it produces defective keratin. One word, bad nails. Three completely different biological mechanisms, three different approaches to address them. Now let us look at a zone that almost no one examines: the skin around the nail plate. Hangnails, those small painful tears of skin at the side of the nail, if they appear repeatedly despite careful nail care, are a marker for zinc deficiency. Zinc is a trace element critical for skin integrity, wound healing, and immune function. When zinc is low, the skin around the nail tears easily inflames and refuses to heal normally. The second cause is low stomach acid, a condition that becomes more common with age and is dramatically underdiagnosed. Without adequate stomach acid, the body cannot absorb zinc, iron, or vitamin B12 properly, regardless of how much of those nutrients are in the diet. One digestive problem creates a cascade: low acid, poor absorption, hangnails, brittle nails, paleness. The whole picture is connected. Persistent redness, swelling, or tenderness at the nail base across multiple fingers, when it does not resolve over several weeks, can be an early manifestation of dermatomyositis, an autoimmune disease in which the immune system attacks its own muscles and skin. There is also a growing diagnostic technique in modern rheumatology called nail fold capillaroscopy, in which a specialist examines the tiny blood vessels at the base of the nail under magnification. In a healthy person, those vessels form neat, uniform loops. In systemic autoimmune diseases such as scleroderma, lupus, and polymyositis, the vessels dilate, deform, and some disappear entirely. The nail fold is an accessible window into the body's microvascular system, and it can reveal disease at its earliest stages before any other symptom has appeared. There is one more finding around the nail that carries a warning people routinely miss: chronic infection at the side of the nail that does not respond to treatment after 6 to 8 weeks can be masking squamous cell carcinoma, a skin cancer that develops in the tissue surrounding the nail if the inflammation keeps returning. If it does not respond to standard care, a biopsy is not optional. It is medically necessary. Now look at the underside of the free edge. If a gap has opened between the plate and the nail bed, if the nail is lifting away from the tissue beneath it, that finding is called onycholysis. Common causes include trauma and chemical irritation, but also an overactive thyroid, psoriasis, and a reaction to tetracycline antibiotics. A person takes the medication, goes out in the sun, and ultraviolet light literally detaches the plate from the nail bed. Almost nobody connects those two events. The connection is direct and well documented in the medical literature. If you are on a tetracycline antibiotic and you notice a nail beginning to lift, contact your prescriber. Never stop a medication on your own. Bring it to your doctor. Now look at the base of your nail. Do you see a white crescent there? That is called the lunula. And most people ignore it completely. It is the visible portion of the matrix, the growth zone. In a healthy adult, it is clearly visible on both thumbs and faintly visible on the other fingers. If it has disappeared entirely from all of your fingers, that can point to anemia, nutritional deficiency in the peripheral tissues, or a sluggish thyroid. If the lunula takes up more than a third of the entire plate, that is associated with an overactive thyroid. One small crescent, two opposite diagnoses depending on what you see. A bluish lunula is rare but significant. It indicates excess copper accumulation in the body, a hereditary metabolic disorder called Wilson's disease. Without treatment, Wilson's disease causes serious damage to the liver and the brain. The first signal may be quiet, sitting right there at the base of your fingernail. A red lunula points toward autoimmune processes, chronic heart failure, or carbon monoxide poisoning. Think of each shade as a warning light on a dashboard. Different colors, different systems, different levels of urgency. One more parameter that most people never think to track: growth rate. Here's a fact that surprises even clinicians. Nails grow approximately 15 to 20% faster in summer than in winter. The reason is improved peripheral circulation in warm weather and higher vitamin D levels from sun exposure. That is normal seasonal variation. But when growth rate deviates from an individual's personal baseline for pathological reasons, it becomes diagnostic. Slowed growth, less than 2 millimeters per month, points to hypothyroidism, poor peripheral circulation from atherosclerosis or Raynaud's phenomenon, or long term smoking. It is also worth knowing that after age 60, growth rate naturally declines by roughly 0.5% per year. That is physiological and unavoidable. Worth knowing so you do not confuse it with a pathological slowdown. Accelerated growth is not always a sign of good health. An overactive thyroid drives metabolism into overdrive. The plates grow faster, but they are thinner, softer, and deform more easily. Psoriasis also accelerates growth because immune cells stimulate the matrix. The result is a nail that grows quickly but is structurally compromised. Quantity is not quality. Asymmetric growth between the two hands, beyond the normal 5 to 10% faster growth on the dominant hand, is worth investigating. Narrowing in the blood vessel supplying the arm and a condition called thoracic outlet syndrome can restrict blood flow to one limb. On the affected side, nails grow more slowly, the plates are thinner, and they are paler. Comparing your two hands takes 3 seconds and requires no equipment. And if growth slowed significantly after an illness or injury and has not recovered in 3 to 4 months, the body has not fully recovered either. A smoldering inflammatory process may still be suppressing regeneration. Nails are a speedometer for recovery. If the needle is not moving, something is still wrong. Everything we have covered so far has been about your hands. Your feet are a separate story, and most people never examine them at all. When did you last look? Really look with good light, socks off, taking your time with each toe. The feet are the farthest point from the heart. That is exactly why the earliest signs of vascular disease show up there first. Toenails are naturally thicker than fingernails and grow about 3 times more slowly. Full replacement takes 12 to 18 months. When a toenail grows so thick it begins to resemble a claw, a condition called onychogryphosis. The most common causes are chronic venous insufficiency and advanced fungal infection. In venous insufficiency, blood pools in the lower legs instead of returning efficiently to the heart. The tissues are deprived of oxygen and the matrix produces abnormal keratin, dense, curved, yellowed. If you have elevated blood sugar, whether diagnosed as diabetes or prediabetes, any crack in the skin around a fungal toenail is an entry point for bacteria that can lead to serious complications. The statistics we mentioned earlier apply directly here. This is not a cosmetic problem to address when you have time. It is a clinical priority. Ingrown toenails, where the edge curves and grows into the surrounding tissue, are most often caused by technique. Rounding the corners of the nail when you trim it feels natural, but it is exactly what drives the edge into the skin. The correct approach is to cut straight across, leaving the length slightly above the level of the skin with no rounded corners. The second cause is narrow footwear compressing the toes. The third is a natural curve in the nail plate that some people inherit. Here is a clinical test that almost nobody outside of emergency medicine knows. Press on the nail plate of your big toe until it turns white, then release. The pink color should return in under 2 seconds. 2 seconds or longer means blood flow to that toe is impaired. Emergency responders use this test routinely to assess circulatory status. You can run it at home every day in under 5 seconds. Under 2 seconds, normal. Over 2 seconds, That circulation deserves evaluation. Cold feet, pale nails, slow growth, recurrent fungal infections. If three or four of those are present at the same time, that is a serious reason to investigate arterial blood flow. The test used for that is called arterial duplex ultrasound. It is non invasive, painless, and widely available. It shows exactly how freely blood is moving through the vessels of your legs, the vascular risks we have been discussing, circulation problems, thickened nails, fungal complications, all of them accelerate with age. After 55, the rate of these processes roughly doubles. How old are you? Drop your age in the comments below. I read every single one. Knowing who is watching helps me choose which topics matter most for the next video. Now, here is the practical system I want you to walk away with. 8 steps, 5 minutes, once a week. This is what I actually want you doing after this video ends. First, examine in proper light. Natural daylight is ideal. Standard household bulbs distort color and can cause you to miss early yellowing or blue-gray tones. Remove nail polish completely. If you wear gel coatings, take them off at least once a month. An opaque layer can hide a process quietly progressing beneath it. Second, assess color. Every plate on both hands, pink and even, is normal. Yellow points to fungal infection or a systemic process. Blue or gray points to an oxygen issue and needs evaluation. Pale across the board suggests possible anemia. A dark stripe means dermatologist today. Do not attempt to diagnose yourself. Photograph each nail once a month on your phone. In 6 months, you have a visual timeline to show a clinician. Third, examine the lunulae. Are they visible on at least your thumbs? Have they changed in size? This appearance of the lunulae is a reason to request a complete blood count and a thyroid panel. Fourth, run your fingertip across each nail. Smooth, normal, longitudinal ridges, usually aging, horizontal grooves, a past systemic event, pitting, warrants evaluation. Anything that appeared recently deserves a conversation with your doctor. Fifth, check the shape, concave or excessively convex. Run the Shamroth test. Press matching fingers, nail to nail. Diamond gap, fine. No gap, schedule a visit. Sixth, test structural integrity. Apply light pressure to the free edge. Does it flex with resilience, or does it crack, peel, or crumble? Brittle points to thyroid or hydration. Peeling points to fat absorption. Crumbling points to fungus or vascular disease. Seventh, examine the perimeter. Hangnails, redness, swelling, tenderness around any nail. Chronic inflammation across multiple fingers is a reason for evaluation, particularly if you have any other joint symptoms. Eighth, examine your feet. Socks off, good light, each toe in turn. Thickness, color, any fungal changes. Capillary refill on the big toenail. Over 2 seconds means a vascular workup is warranted. 8 steps, 5 minutes, once a week. Compare what you see to what you saw the week before. Photograph it, write it down. Treat this with the same seriousness you give your blood pressure reading or your blood sugar number. Your fingers carry as much diagnostic information as a blood pressure cuff. The body gave you a free diagnostic instrument that runs continuously, requires no batteries, no subscription, and no appointment. It is working right now at the end of your hands. Everything I just walked you through is the kind of information that rarely makes it into a standard clinic visit. There is simply no time for it. If you want to go deeper, the full plain English guides covering your medications, your nutrition, and what your body is telling you after 70 are all together in the Senior Health Vault. The code is still on your screen, and you will find the link in the description below. I want to be clear about something. What you heard in this video is educational information, not personalized medical advice. Every body is different, every history is different, and nothing here replaces a conversation with your own physician. What I hope it does is give you better questions to bring to that conversation. Drop your age in the comments and tell me which of these signs you already knew about. I read every single one. And if this helped you, Send it to someone you care about, a parent, a neighbor, someone who might be ignoring a signal right now that they did not know meant anything. You may have just given them a real chance to catch something early. I made a video that explains exactly what your morning urine color is telling you about your kidneys and your circulation, including two signs that show up years before a diagnosis. I will put it right here on the screen. Go watch that one next.